Mga posibleng tanong na maaaring lumabas ngayong darating na Philippine Nursing Licensure Examination ang alay ko sa inyo for today. 15 board exam type of questions with rationalization that will cover your community health nursing and maternal and child nursing. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that out. Subscribe now, hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, let's jump into the video, nurses. Hi everybody! Welcome back nga sa another nursing test banking video. Kagaya ng nakita nyo sa title at nakikita nyo sa sinabi ko kanina sa intro, today is another nursing test banking. We are going to, or I'm gonna give you 15 board exam type of questions that will cover your community health nursing and maternal and child nursing. Now, maraming salamat po sa lahat ng sumusuporta at sa mainit na pagtanggap nyo sa mga nursing test banking videos ko. Nako, parami na nga tayo ng parami at nagugulat pa rin ako sa lahat, sa dami ng nanonood at bumabalik sa channel ko at nagsasabing malaking tulong yung nursing test banking videos. Kaya naman, eto na, bibigyan ko kayo ng marami pang tanong na posibleng lumabas ngayong darating na board exam. Nga pala, let me grab this opportunity to thank everybody and congratulate you who's watching right now for passing the board exam. Yay! Congratulations! Now, if there's anything that I want you to take out from this video, kagaya ng lagi ko sinasabi, it is the rationalization. It doesn't matter. The main intention of this video is for you to have a full grasp of the rationalization so that when the day comes that you are about to take or you're already taking the board exam, you are very much aware or very much knowledgeable when it comes to the reason why that is the correct answer. So hindi ko na patatagalin pa kasi medyo mahaba itong video na to. In order for me to do that, let me switch back to my PC and I'll see you guys in a bit.
Alright, so hi everyone, welcome back sa ating formal discussion ng yung community health nursing and care for mother and child. This is another entry natin sa ating nursing test banking kung saan gumagawa tayo ng mga lecture materials, mga possible questions na maaaring lumabas sa darating na board exam o sa board exam, sa Philippine Nursing Licensure Examination. Now, itong nursing test banking ay isa sa mga playlist sa channel ko kung saan I dedicate this to all the upcoming test takers natin because not only I cater to the Philippine Nursing Licensure Examination, but I'm also gonna put on that playlist, questions that possibly, mga questions na maaari mo ma-encounter sa NCLEX, sa HAAS, sa PROMETRIC, DHA, at sa kung saan-saan pang klase ng examination sa nursing. Ngayon, kung hindi mo pa napapanood yung mga other videos na create ko regarding sa nursing test banking, nako, ilalagay ko yung actual playlist sa description box or kapag nag-pop out yung icon button, i-click mo lang yon kasi ilalagay ko siya doon kasama na ibang mga nursing educational contents ko dito sa channel ko. Ngayon, I would just like to grab this opportunity to thank you, especially you who's listening and watching right now, for all your love and support. We've been really growing at napakainit nga po ng pagtanggap nyo sa ating mga nursing test banking videos. Maraming salamat po. Natutuwa ako tuwing may bumabalik, nagko-comment na nagsasabing napakalaking tulong nitong videos ko sa pag-aaral nyo, pagre-ready nyo kasi alam nyo naman sa nursing, paulit-ulit lang yung minsan, paulit-ulit lang talaga yung mga tanong na iba lang na itsura, na iiba lang ng anyo, okay? Now, wag na tayo magpantumpik-tumpik pa. Ano daw? Simulan na natin to. Alright, so let me share to you our objectives for today. Well, I will provide and discuss board exam type of questions to you, and I'm also going to provide rationalization per each board exam type of questions. Now, if there's anything that I want you to take out from this discussion, it is the rationalization. Of course, very important na magkaroon tayo ng, magandang score or mataas na score. Pero, the purpose or the intention of this video is really for you to have a full grasp about the rationalization. Kasi para pagdating sa araw ng exam, alam mo kahit paikot-ikuting ka, may ibang anyo, may ibang itsura, may ibang kung ano man ang klase ng scenario, alam mo why we come up with that answer, and you know for sure, you're 100% sure bakit yun ang tamang sagot because you know the rationalization behind it. You understand? Let me share to you our instructions for this test for today. You'll be given 15 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer. Good luck, nurses. Handa ka na ba? Now, I want you to take this seriously as if you're taking the actual board. Okay? So, simulan natin. Board exam type of question number 1. May arrives at the healthcare clinic and tells the nurse that her last menstrual period was 9 weeks ago. Let me change here to my pen. 9 weeks ago. That's the LMP. She also tells the nurse that a home pregnancy test was positive, but she began to have mild cramps and is now having moderate vaginal bleeding. During the physical examination, the nurse notes that May has dilated cervix, mild vaginal bleeding, moderate vaginal bleeding. The nurse determines that May is experiencing which type of abortion. Now, sa tanong na ito, nurses, tinatanong ka, hinihian ka, anong klase ng abortion ito kapag ito yung clinical manifestation mo? Dilated cervix, moderate vaginal bleeding, and 9 weeks ago, ang last LMP. Meron pa dito yung mild cramps. Okay, anong klaseng abortion yon concerning the 9 weeks last LMP? Is it A, inevitable? Is it B, incomplete? Is it C, threatened? Or D, septic? Your 5 seconds starts now. Time's up. The answer to this question is letter what? Letter A. Perfect. Sino nakatama doon? Why? Well, an inevitable abortion is termination of pregnancy that cannot be prevented. Moderate to severe bleeding with mild cramping and cervical dilation will be noted in this type of what? Abortion. The answer is A. Next. Board exam type of question number 2. Nurse Reese is reviewing the record of a pregnant client for her first prenatal visit. Which of the following data, if noted on the client's record, would alert the nurse that the client is at risk for spontaneous abortion? Alin dito ang indication or clinical manifestation ng spontaneous abortion? That's the question. Is it A, age 30? Not really clinical, clinical presentation, but the risk for spontaneous abortion, predisposing factor. Is it A, age 36 years, B, history of syphilis? Is it C, history of genital herpes? Or D, history of diabetes mellitus? Your 5 seconds starts now. Time's up, nurses. Alright, the answer to this question is letter what? Letter B, history of syphilis. Nako, bakit naman? History of syphilis nga po ang tamang sagot because maternal infections such as syphilis, toxoplasmosis, and rubella are causes of what? Spontaneous abortion, period. Board exam type of question number 3. Nurse Hazel is preparing to care for a client who is newly admitted to the hospital with a possible diagnosis of what? Ectopic pregnancy. That's your diagnosis. Nurse Hazel develops a plan of care for the client and determines that which of the following nursing intervention is the priority. Priority nursing intervention mo sa pasyenteng diagnosed with ectopic pregnancy. Is it A, monitoring weight? Is it B, assessing for edema? Is it C, monitoring apical pulse? Or D, monitoring temperature? Your 5 seconds starts now. Time's up. The answer to this question is letter C. Perfect. Monitoring apical pulse. Why? Nursing care for the client with possible ectopic pregnancy is focused on preventing or identifying hypovolemic shock and controlling pain. An elevated pulse rate is an indicator of what? Shock. Nako, speaking of shock nga po, nagkaroon ako ng bagong upload ko lang yon about sa cardiogenic shock and hypovolemic shock, neurogenic shock. Nandun siya sa playlist ng medical surgical nursing kasama ng iba ko pang mga create na video under med-surg. Panoorin mo siya ha, nandun siya. Binigyan ko kayo ng thorough discussion as in really, really, really thorough about shocks. Shocks! Ang dami, di ba? Okay. Proceed na tayo. Board exam type of question number 4. Nurse Oliver is teaching a diabetic pregnant client about nutrition and insulin needs during pregnancy. The situation is about nutrition and insulin needs during pregnancy. The nurse determines that the client understands dietary and insulin needs if the client states that the second half of pregnancy require. Is it A, decreased caloric intake? Is it B, increased caloric intake? Is it D, decrease insulin? Or C, or is it D, increase insulin? So, alin dito ang magsasabing positive finding mo na nag-go through yung health teachings mo sa client regarding dietary and insulin needs during second half of pregnancy? Your 5 seconds starts now. Time's up. The answer to this question, nurses, is letter B. Increased caloric intake. Why? Glucose crosses the placenta, but insulin does not. High fetal demands for glucose combined with the insulin resistance caused by hormonal changes in the last half of pregnancy can result in elevation of maternal blood glucose levels. This increases the mother's demand for insulin and is referred to as the diabetogenic effect of pregnancy. Gets yon? Gets. Let's proceed. Board exam type of question number 5. Nurse Michelle is assessing a 24-year-old client with diagnosis of what? Hydatidiform mole or molar pregnancy. Some books actually define or call it molar pregnancy. She is aware that one of the following is unassociated. Alin dito ang walang kinalaman sa hydatidiform mole? Yun yung tanong. Is it A, excessive fetal activity? Is it B, larger than normal fetus for gestational age? Is it C, vaginal bleeding? Or D, elevated levels of human chorionic gonadotropin? Your 5 seconds starts now. Now, pwedeng makatulong sa itong visuals na to ha, para mas maunawaan mo kung ano ba ibig sabihin ng molar pregnancy. Yung hydatidiform mole. The answer to this question though is letter A, excessive fetal activity. Why? The most common signs and symptoms of hydatidiform mole includes elevated levels of human chorionic gonadotropin, vaginal bleeding, larger than normal uterus for gestational age, failure to detect fetal heart rate, heart activity, even with sensitive instruments, excessive nausea and vomiting, and early development of pregnancy-induced hypertension. Fetal activity would not be noted kasi nga wala naman talagang pregnancy in the first place. It kind of like mimic the pregnancy but pregnancy presentation, pero it doesn't really have a baby in the first place. There's no growing fetus, period. All right. Board exam type of question number 6. A pregnant client is receiving magnesium sulfate. Pharma. For severe pregnancy-induced hypertension, PIH, the clinical findings that would warrant use of antidote. Meaning, bakit ka na gumamit ng antidote mo? Kasi nag-reach na sa toxicity. Anong antidote ng magnesium sulfate mo? Calcium gluconate. Ang tanong ito, kailan ka gagamit ng calcium gluconate sa pasyenteng nag-undergo o nagre-receive ng treatment for pregnancy-induced hypertension? Ang medication that is being used is magnesium sulfate. Kailan ka gagamit ng antidote na calcium gluconate? That's the question. Is it A, urinary output 90 cc in 2 hours? B, absent of patellar reflexes? Or C, rapid respiratory rate above 40 cycles per minute? Or D, rapid rise in blood pressure? Your 5 seconds starts now. The answer to this question, nurses, is what? Letter B, perfect. Absent patellar reflexes nga po. Why? Absent of patellar reflexes is an indicator of hypermagnesemia, which requires administration of calcium gluconate. Yun na yun. Alright. Number 7, nakakailan na kayo? Galaw-galaw, hinga-hinga. Charing. Okay, during vaginal examination of Jana who is in labor, the presenting part is at station +2. Ano daw ang presenting part? Station +2. Nurse correctly interpret it as, anong interpretation nun? Anong clinical significance ng pag sinabing station +2? Okay, is it A, presenting part is 2 centimeters above plane of the ischial spine? Is it B, biparietal diameter is at the level of the ischial spine? Is it C, presenting part in 2 centimeter below the plane of the ischial spine? Or D, biparietal diameter is 2 centimeters above the ischial spine? Your 5 seconds starts now. OB question. Time's up. The answer to this question is letter C. Presenting part in 2 centimeters below the plane of the ischial spine. Fetus at station +2 indicates that the presenting part is 2 centimeters below the plane of the ischial spine. Ang point of reference mo dito lagi, ang landmark mo is the ischial spine. Ito po siya. I hope na makatulong itong picture na ito sa pag-remember mo sa concept about a presentation and stages of labor. Okay? Board exam type of question number 8. A pregnant client is receiving... Bakit baka nabubulol? Isa pa ulit. Take 2. A pregnant client is receiving oxytocin, brand name Pitocin, for induction of labor, a condition that warrant the nurse in charge to discontinue. IV infusion of Pitocin is kailan daw i-discontinue ang IV infusion ng oxytocin? Is it A, contractions every 1.5 minutes lasting 70 to 80 seconds? Is it B, maternal temperature of 101.2 degrees Fahrenheit? Is it C, early decelerations in the fetal heart rate? Or D, fetal heart rate baseline 140 to 160 beats per minute? Your 5 seconds starts now. Time's up. The answer is letter A. Perfect. Contractions every 1.5 minutes lasting 70 to 80 seconds. Bakit? Contractions every 1.5 minutes lasting 70 to 80 seconds is an indicative of hyperstimulation of the uterus, meaning sobrahan na naman sa stimulation ang iyong bahay bata, which could result in injury to the mother and the fetus if pitocin is not discontinued, kasi mag-fetal distress si baby at hindi rin yun nakakatulong kay mommy. Okay, so that's why the answer is letter A. Nako, ilan na to? Last 6 questions na ba? Galaw-galaw. Nakakarami na ba kayo ng tamang sagot? Okay. Dagdagan natin yan. Board exam type of question number 9. Calcium gluconate is being administered to a client with pregnancy-induced hypertension. Ito na naman si PIH, ha? A nursing action that must be initiated as a plan of care throughout injection of the drug is, alin daw ang initiate mo kapag nag-a-administer ka ng calcium gluconate through IV? Is it A, ventilator assistance, B, CVP readings, C, EKG tracings, or D, continuous CPR? CPR agad, girl. Hey, are you okay? Tapukin kita. For 5 seconds starts now. Time's up. The answer is letter perfect. C, EKG tracings. Bakit, nurses? A potential side effect of calcium gluconate administration is cardiac arrest. Continuous monitoring of cardiac activity through EKG through administration of calcium gluconate is an essential part of care. Perfect. All right. Hindi pa pala. Question number 10. A trial for vaginal delivery after an early cesarean would likely to be given to a gravida who had, ang tanong, nurses, ito lang naman kung di nyo naunawaan. What is the indication of VBAC, vaginal birth after cesarean delivery or section? Is it A, first low transverse cesarean was for active herpes type 2 infections? Vaginal culture at 39 weeks pregnancy was positive. B, first and second cesareans were for cephalopelvic disproportion. C, first cesarean through a classic incision as a result of severe fetal distress. Or D, first low transverse cesarean was for breech position, fetus is Fetus in this pregnancy is in vertex presentation. Your 5 seconds starts now. Time's up. The answer is letter D. Who got this one right? First low transverse cesarean was for breech position. Fetus in this pregnancy is a vertex presentation. Bakit? This type of client has no obstetrical indication for a cesarean section as she did with her first cesarean delivery. Oo nga naman. Pero kung siguro ito ay nagkapalit, let's say sa pangalawang pregnancy niya, ngayong pregnancy niya is breech pa rin, tapos nung una is breech, wala na talaga. Ano na talaga to? No chances of VBAC. Okay, malinaw yan? Malinaw. Board exam type of question number 11. Nurse Ryan is aware that the best way or best initial approach when trying to take a crying toddler's temperature is, itong tanong, kapag ang toddler mo ay nagmumuryot, tapos magte-take ka ng temperature, what is your best initial approach to that toddler? Is it A, talk to the mother first and then to the toddler? Is it B? Is it B, bring extra help so it can be done quickly? Is it C, encourage the mother to hold the child? Or D, ignore the crying and screaming? Pag in-ignore mo tong gigigil ako sa'yo. Your 5 seconds starts now. Time's up. The answer to this question is letter A. Talk to the mother first and then to the toddler. Why, nurses? When dealing with a crying toddler, the best approach is to talk to the mother and ignore the toddler first. Now, this approach helps the toddler get used to the nurse before she attempts any procedures. It also gives the toddler an opportunity to see the mother trusts the nurse. Diba? Kukunin mo muna, i-gain mo muna yung trust ng toddler by, showing to the toddler that you have a rapport with with his parents or her parents. Kasi ang go-to person ng mga toddler natin, itong age group na to, ay ang kanilang parents, mama and baba. Let's proceed. Board exam type of question number 12. Baby Tina, a 3-month-old infant, just had a cleft lip and palate repair. Ano yung cleft lip and palate repair? Calioplasty, yun ba yun? Nakalimutan ko na, pero parang yun. I-comment mo sa baba, Caloplasty? What should the nurse do to prevent trauma to the operative site? Prevention of trauma sa pasyenteng nag-undergo ng cleft lip and palate repair surgery. What are you gonna do as a nurse? Is it A, avoid touching the suture lines even when cleaning? Even when cleaning, ang galing. Is it B, place the baby in prone position? Isa ka pa. Give the baby a pacifier? Wow. Or D, place the infant's arms in soft elbow restraints. Your 5 seconds starts now. Time's up. The answer to this question is letter D. Place the infant's arms in soft elbow restraints. Why? Soft restraints from the upper arm to the wrist prevent the infant from touching her lip but allow him to hold a favorite item such as a blanket. Because they could damage the operative site, such as objects as pacifiers, suction catheters, and small spoons shouldn't be placed in a baby's mouth after cleft repair. A baby in a prone position may rub her face on the sheets and traumatize the operative site. The suture line should be cleaned gently to prevent infection, which could interfere with healing and damage the cosmetic appearance of the repair. That's why the answer is letter D. Malinaw? Malinaw. Nako, last 3 questions na ha. Make it count. Which action? Question number 13. Which action should the nurse Marian include in the care plan for a 2-month-old infant with heart failure? Age group mo, 2-month-old infant na merong heart failure. Ano yung i-include mo sa nursing care plan mo, NCP mo? Is it A, feed the infant when he cries? B, allow the infant to rest before feeding? Is it C, bathe the infant and administer medications before feeding? Or D, weigh and bathe the infant before feeding? Your 5 seconds starts now. Time's up. The answer is letter B. Allow the infant to rest before feeding. Bakit, nurses? Because feeding requires so much energy. An infant with heart failure should rest before feeding. Naalala mo yung clinical condition ng yung pasyente and diagnosis mo is heart failure. It will, even feeding for this type of patients, lalo na 2-month-old, it will require energy for them. It is a task. It is a chore for them. You know what I mean? That's why you need to encourage rest before feeding. All right. Board exam type of question number 14. Nurse Hazel is teaching a mother who plans to discontinue breastfeeding. Discontinuation of breastfeeding, that is your situation, after 5 months. The nurse should advise her to include which foods in her infant's diet. Is it A, skim milk and baby food? Skim. Is it B, whole milk and baby food? Or C, iron-rich formula only? Or is it D, iron-rich formula and baby food? Your 5 seconds starts now. Time's up. The answer is letter C. Iron-rich formula only. Pag may sumagot ng whole milk, sapukin kita. Bakit itong sagot? Well, the infants at age 5 months should receive iron-rich formula and that they shouldn't receive solid food. Even baby food until age 6 months. Kailan tayo nagsastart ng feeding? 6 months above. Alright, last question na tayo. Make this one count. Board exam type of question number 15. Mommy Linda is playing with her infant who is sitting securely alone on the floor of the clinic. The mother hides a toy behind her back and the infant looks for it. The nurse is aware that the estimated age of the infant would be. Binigyan ka ng description ng bata. Ulitin ko para sa maintindihan mo. Kasi tinatanong ka, mag-estimate ka ng age. Ang ganito ang tanong, estimation ng age base sa observation mo. Ito yung na-observe mo. Nakakaupo na yung bata alone. Tama? Tapos yung mother, may hawak siyang toy and she hides that toy behind her back and the infant started to look for it. Yun yung mga key-term mo. Ilang taon na yung batang yun? Is it A, 6 months, B, 4 months, is it C, 8 months, or D, 10 months? Your 5 seconds starts now. Time's up. The answer is, ang galing mo, 10 months. Why? A 10-month-old infant can sit alone and understands object permanence. Who is sitting alone? Kita mo to? Yun. And this infant can understand object permanence. Ano yun? The infant looks for it. That's object permanence. So he would look for the hidden toy. At age 4 to 6 months, infants can't sit securely alone. At age 8 months, infants can sit securely alone but cannot understand the permanence of objects. Hence, the answer to this question is letter D, 10 months. Alright, tapos na nga tayo, nurses. Thank you so much for watching, listening, and answering these questions for me. Please like, share, and subscribe to my channel for more nursing educational. What is happening to me today? For more nursing educational videos, let me know if you have other nursing topics that you want us to do. Put it down in the comment section below. Abangan nyo nga po yung mga next videos natin regarding sa nursing, test banking, at sa iba pang mga concept and areas sa nursing. I-upload natin yan sa mga susunod na araw. Pakilagay po ang score nyo sa baba. Muli gusto ko kayong anyayahan na i-follow ang aking Facebook page. It's Neil Galvez. Lalagay ko yung link sa description box. Kasi nagpo-post din po ako doon, and if you want to reach out to me, you can actually do that there or in any of my social media accounts. I actually have a lot. Everything is at Neil Galvez except for my TikTok account, which is Neil Galvez Official. All right? Maraming salamat po sa pagtangkilik at sa panonood. And help me out, spread the news about my channel. Ipamalita mo na sa radyong sila pinakabago, pinaka-fresh at ang pinaka-libreng nursing review center sa balat ng YouTube. And I'll see you again next time.
Thank you so much, you guys, for watching. I hope you learned something. Help me grow my channel. You're already here. You might as well subscribe. Hashtag Team Kulta. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links links on the description box or simply click the second button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Gave except for my TikTok account, which is Neil Gave Official. I'll see you again. Patatagalin pa kasi medyo mahaba itong video na to. Gusto mo yung ganon?